Direct-to-consumer advertising is a complicated public policy issue with a number of pros and cons. However, healthcare providers should question its value to delivering quality care to the patient. Advertising for prescription medicines have recently evolved to include the consumer, whereas pharmaceutical companies had previously marketed their products only to physicians and nurse practitioners. It wasn't until 1997 that the FDA updated the law for prescription drug companies to provide a summary of the most important risks for each drug. According to IEG research, this commercial you just saw was the most remembered new drug ad for the year 2007. Time magazine states that it is widely understood by psychologists and the advertisement industry that when any one person is presented with a list of things, he or she is most likely to remember items at the beginning and at the end of the list than items.
Direct-to-consumer advertisement companies follow this technique when formatting their commercials. The benefits are stated in the first half of the commercial and at the end, with the side effects information revealed just past the middle of the commercial. Next time you see an advertisement for prescription medicine, try to see if that commercial follows the pattern of the Nasonex one you just saw. Studies show that direct-to-consumer advertising does in fact increase a patient's request for the drug being advertised. According to the Yale Journal of Medicine and Law, 91% of medical practitioners in a study published in the British Medical Journal felt pressured by their patients to prescribe a specific drug that they had seen in direct-to-consumer ads. Of these doctors, 30 to 36% actually prescribed the drug requested even though it was described as not their first choice but merely acceptable.
On the other hand, Yale Journal of Medicine and Law also stated that 64% of doctors cited DTC advertising as a major motivator for patients to seek medical care as reported by the American Medical Association. Patients are more likely to visit their primary care doctor and ask them about other related health conditions as well as refill their prescriptions. The majority of commercials end with phrases suggesting that the viewers visit the provider for more information. This encourages doctor-to-patient dialogue. Internet users who are exposed to the advertisement of prescriptions online often can discover a new medication that meets their needs that they may not have otherwise had access to. Those who are prohibiting these changes that could benefit the healthcare system are the pharmaceutical companies. Pharmaceutical companies, like any other business, rely on a profit to keep their company going. Therefore, they rely on the income from DTC advertising in order to be successful and continue to introduce new medications to the public. By prohibiting DTC advertising, the issue of freedom of speech would be raised. Congress would need to amend the Federal Food, Drug, and Cosmetic Act. This law may not need to necessarily be changed if the FDA upheld a more strict policy for DTC advertising.
Recently, the FDA has developed a program called the Bad Ad Program, which helps healthcare providers recognize misleading drug promotion and provides them with an easy way to report this activity to the agency. The prescriber can play an important role in ensuring that prescription drug advertising and promotion is truthful by recognizing and reporting misleading drug advertising and promotion. Patients could have the ability to play a more active role by being aware of the many advertisements and promotions that they see on a daily basis. Prescription drug advertising should be accurate and should have a more equal balance between benefit and risk information. Doctors who see patients interested in a brand name medication should put their patient's best interest first, regardless of the influence that the advertisements may have over a patient seeking medical attention. This may be difficult due to the sales representatives who visit doctors' offices regularly promoting their medications. This has an overwhelming impact on the practitioner's decision to prescribe medication to his or her patient.